Sometimes, if there is an emergency at the front line, I would have to go at 2 a.m. and use the route where the SAC is, and that's quite risky.
We can survive as long as we make efforts. What is important is our determination.
The doctors and nurses of Myanmar were at the forefront of protests against the military coup 3 years ago. Tens of thousands joined the Civil Disobedience Movement, and many are still trying to provide healthcare both inside and outside the country, at great risk to themselves. Hello and welcome to Do'athan, a weekly podcast about human rights stories from Myanmar. It's brought to you by Fondation Hirondelle. This episode is produced by journalists from Delta News Agency. Names and voices may have been changed to protect contributors.
I cannot carry medical syringes if I want to go and help a friend in need. I'm afraid I might get arrested by the police on the way, and because of that, I don't dare take them with me. So there have been cases when I cannot go and help in time.
Rain is a senior nurse living on the Thai border who's trying to provide medical help to Burmese people in the area. She's not allowed to work legally as a nurse in Thailand, so she has to be very careful. Rain and her husband participated in the protests against the military coup in February 2021 and both joined the Civil Disobedience Movement, or CDM. But her husband went back to his job. She left him and took the 3 children to the jungle, where she worked for a while before she moved to Mae Sot. Here she gives medical treatment, often free, to political exiles, refugees, migrants, and sometimes injured resistance fighters. Many of them cannot travel around Mae Sot safely because they're undocumented and risk arrest and possibly deportation if they're stopped by police. So her services are invaluable to these people. But by going to them, Rain faces the same sort of risk from Thai police. She's already had to pay 3 fines to avoid arrest. And it's not only the police she needs to be wary of. Recently, a local Burmese guy threatened to report her to the police.
Over here, I think some Burmese people don't have good intentions towards fellow Burmese people. They act like they know more since they got here first and would like to threaten people like this. But I would not let that stop me. I carried on doing whatever I could. So that's probably why they threatened to report me for having medical supplies, as a way of teaching me a lesson.
There are other medics trying to help people in Mae Sot facing the same sort of challenges, but Rain says some have given up working because of the risks. It's even more dangerous operating as a CDM medic inside Myanmar. Ei Zin is a nurse in her 30s who joined the CDM after the coup and opened a free clinic with other colleagues in her hometown in southern Myanmar. But within the month, they had to close.
The news got out because we usually started from there when we wanted to go on protest. So they surrounded us. That night, I had to go up to the water tank to hide. The next morning, I moved to the clinic in the early morning and continued to look after the patients. A week later, we received news that they would come to raid our clinic, so we had to run, taking all the medical supplies with us.
After that, she was on the run. She continued to give medical treatment where she could. Officers from the so-called State Administration Council, or SAC, tracked her down a few times, but somehow she always managed to escape. In the end, she cut off contact with her family for security reasons and fled to the jungle. She's working with a medical team in a conflict area, treating internally displaced people, injured fighters, and locals who need healthcare. But she faces the risk of arrest if she's in SAC-controlled areas.
I had a narrow escape one time because I was called to another village to take care of a sick patient. I only had medicines with me and nothing else to defend myself. Sometimes, if there is an emergency at the front line, I would have to go at 2 a.m. and use the route where the SAC is, and that's quite risky.
According to Insecurity Insight, since the coup, there have been over 1,100 incidents of violence against or obstruction of healthcare in the country. That includes 49 incidents in which Myanmar military aircraft dropped explosive weapons which damaged clinics, hospitals or pharmacies and killed or injured health workers. Almost 900 health workers have been arrested. The CDM medical network said that at least 89 medics have been killed since the coup. A network spokesperson pointed out that there are international laws which should protect medical workers during conflict.
Although the healthcare workers, volunteers and Red Cross staff are not supposed to be targeted during wars, the SAC is currently going against such rules and arresting healthcare staff who are providing healthcare.
The CDM medical network, which is under the National Unity Government or NUG, has been supporting and raising funds for healthcare workers since 2021. At the beginning, there were more than 60,000 CDM medical workers, but these days the network estimates that there are probably only 40,000 medics in the movement. The others have gone back to work or have found jobs in other fields. As well as the risks to them in continuing medical work, they don't get enough financial support to survive. The CDM medical network can usually only provide around 50,000 chat to between around 60 and 200 medics every month, depending on the spring lottery. That's not even 1% of the total number of CDM medics. Dr. Bio was elected as an NLD Member of Parliament, representing North Dagon Township in Yangon Region in the 2020 elections. He says when the NUG comes to power in Myanmar, there are plans to reward CDM-ers who made these kinds of sacrifices.
This is a commitment made by the NUG government. It is that the CDMers will be given their original salary in one lump sum from the time of the coup, from the time the CDM started, when the NUG government regains control of the administration. They will surely receive this, and it is guaranteed. We should also consider giving promotions, depending on what they had to sacrifice too.
But Dr. Bio conceded that nobody knows what the country's financial situation will be like after the revolution.
We don't know how much budget will be left at the time of the recovery process. The country has turned to ashes and it's become so broken. We would have to see if it's doable with the compensation alone. Otherwise, we might have to wait for longer.
In fact, these sorts of benefits are not as important for many CDM nurses as a new and more democratic way of working. A CDM conference was held in January at which nurses said they want to be involved in drafting new regulations and laws for their sector. They also want an end to bullying by doctors, as does Nurse Rain.
What we want is democracy and freedom, the right to say something out loud when it's not right. I would be content if we didn't have to suck up to the seniors like they're gods. I want there to be fair treatment and no bullying from the higher-ups, some of whom are only appointed because of their connections.
Nurse Ei Zin agrees.
In the past, I used to get harassed while working as a nurse, and I was not able to defend myself properly. Instead of that, I would like a workplace where I can defend myself if I'm being bullied or harassed, like in an international working environment.
Despite the risks and the difficulties, many CDM medics are still working inside Myanmar and outside. Rain is surviving through payments from some of her patients who can afford it, and support from her wider family. She's a single mother with 3 children in a foreign country, but she's determined to carry on what she's doing, and she wants to encourage others.
I don't want people to think of me as a pitiful person, but rather to be inspired by what I'm doing. Because if I can still support myself and 3 children, there must be other women like me who may have been divorced or abandoned or become widowed. I would like to encourage you not to give up, even if you want to, because of these reasons. We can survive as long as we make efforts. What is important is our determination.
Thanks for listening to this edition of Doathan. We'd welcome your feedback on social media. This project on human rights reporting is supported by Fondation Hirondelle with the help of our donors. You can listen to our podcasts via the Doathan Facebook page. They can also be found on SoundCloud, YouTube, iTunes and Spotify. You can also listen every Saturday night from 9 to 10 p.m. and Sunday morning from 6 to 7 a.m. on Voice of America Radio. Please tune in again next week.